In Boston, the number of people with coronavirus has been increasing exponentially, with nearly 30 times the number of cases today as there were just 2 weeks ago when the city first declared a public health emergency. Among those who's tested positive for the virus is former Boston City Councilor and former mayoral candidate Tito Jackson. He's now the owner and CEO of the recreational and medical marijuana company Verdant Medical. He joins me now. Tito, I haven't seen you in a while. It's a hell of a way to reconnect. How are you?
I'm doing well, Jim. Thank you so much. I'm on the mend.
So I read your symptoms for people who are curious and nervous. Day 1, mild, and day 2 hit you like a ton of bricks. Is that right?
Exactly. So I had a sore throat initially, and then I ended up having a really bad, initially a bad cough. And then that next day, the fever as well as headache. And then the third day, really bad muscle throbs, aching, pain. And then it just got worse from there. I began to have shooting pain, my joints, and really bad back pain.
Were you scared? Were you scared?
Yeah, I was definitely scared. I initially thought I had the flu. I hadn't had the flu shot, but I definitely was scared, and most scared for anybody I had come in contact with, because I definitely didn't want to harm any of my friends, family, or loved ones. So I locked myself down on the second day and have been in quarantine ever since.
But you were able to get tested. How difficult was that? Because we hear stories that the rich and powerful don't have a hard time, and average people, and you've got a bit of a reputation in town, but mere mortals have a really tough time. How was it for you?
Yeah, the rich thing is probably not the best description of me right now. But when it comes to what happened for me is I actually had a friend call and let me know that she had been she had tested positive. So I went directly over to Kearney Hospital. I actually called my doctor first, went to Kearney Hospital, and I was in and out in about 15 minutes. The test is not comfortable. They put a large Q-tip up your nostril, and then for about 10 seconds, and then they do the other side, and then you're actually done. Brief questionnaire prior to that, but you're really in and out 15 minutes. So I would advocate people who actually do have symptoms to go get checked out, in particular the ones who know that they have been exposed.
Can we step back for a second, Tito, and talk about some larger issues? You, as a city councilor, represented many people of color, many people in communities you represent, I think it's fair to say, are been marginalized in so many ways by society. There's a Pew Center poll a couple of days ago saying African Americans and Latinos were 2 times more likely than whites to see coronavirus as a major threat. Are they right to feel that way?
I think they're right to feel that way for 2 reasons. One, because of access to health care and people's feelings about their access to health care, but also around healthcare disparities. So when you look at the people who have the highest rates of COPD, people who have the highest rates of, all of hypertension, diabetes, and all of the predispositions to this, we definitely want to make sure that people know that this disease state definitely does hit Black and Latino and Asian and white people. This disease state does actually not, it doesn't discriminate. And the coronavirus is actually coming after all of us, but in particular, those people who have comorbidities or pre-existing conditions. So I think it's critical. And I want to address the fact that there were some rumors out there that Black people did not get corona. That is absolutely false. It's something that I want people to know that it does hit us. And it hits us very, very hard. And you don't know whether or not it's going to put you in the hospital or not. That's why social distancing is so important. I have a friend who is about 10 years younger than me, and she ended up actually in the hospital with pneumonia. You don't know. She's very healthy, and I actually was able to weather this at home.
I want to get back to what you said a minute ago. Yes, it's true that all people are created equal in the sense that anybody can get coronavirus, but not all people come into coronavirus equally, which I guess is your point, and that's why concerns in communities of color are greater and merited, I guess. Margie Egan and I talk a lot on the radio about whether anything good is going to come out of this nightmare when it's finally over. Are we going to care more about public health preparedness? Are we going to care more about a whole host of things, care more about our fellow men and women? Are we going to care more about the health disparities in the society that long predated coronavirus, or is this a passing thing?
I don't think it can be a passing thing. I think we now have to all rally together and address, as you're noting, healthcare disparities did not actually start with Corona. They're exacerbated by Corona. I have a friend, Monica Cannon, who runs an organization called Violence in Boston. She's feeding 1,775 people every single day in the Roxbury area. The food insecurity didn't start with Corona. And so these needs and these disparities have to be addressed. The issues around people having paid medical leave is a critical component, because we're just as safe as that worker who can't go home and actually has to work that extra shift. This also means we need to be paying people a decent amount. The folks who work in these grocery stores, the people who are cleaning all of these hospitals, the doctors, nurses, and we see there's issues in that space now. We have to use this crisis as an opportunity to relook at and reorganize the priorities that we have around all of these issues and disparities.
One quick follow-up there is that people of color are less likely to have paid sick leave, as you were noting a minute ago, but I want to make that clear. We only have 30 seconds left. There is an economic impact here, too, needless to say. As you well know, liquor stores essential, medical marijuana not essential. Very quickly, how's your business going to fare, and how's the industry going to fare through this shutdown?
This has been a horrific, is having a horrific effect on the recreational as well as medical business that is, inextricably connected. I believe that the legislation was written as alcohol, and that the recreational stores need to be able to open. In addition, let's also talk about the fact that they've only been open for a year. And so can you imagine what that means in the first year that you have been completely shut down? Your workers who've been trained, and all of the resources that have been placed in the business, they should be treated the same way as stores that sell liquor. This is a burgeoning industry, and it's actually going to help the bottom line relative to getting out of the hole that we're in. So I would press upon the governor to change his mind on this particular topic.
Tito Jackson, thank you so much. Appreciate it. We should note for the record that while recreational marijuana stores are not considered essential, medical are.
Yes, definitely. Thank you so much.